Hello and welcome to Wednesday's Weekly. This is your weekly bite-sized briefing, a collaboration between Action Together, the voluntary community and faith sector and the public sector. I'm delighted to welcome you this morning to the sixth episode in our cost of living crisis series. So Action Together are working with Oldham Council to welcome you every Wednesday between now and next March to hear from services and the organisations that are working alongside you in Oldham, delivering critical help to support Oldham residents through the cost of living crisis. Without further ado, I'm absolutely delighted to hand you over to Jenny Higson, who will be taking us from here. So over to you, Jenny.
Thanks, Laura, and welcome everybody. I'm Jenny Higson. I work at Tameside, Oldham and Glossop Mind. In Oldham, we have got a wellbeing centre based on Union Street, almost opposite First Choice Homes. But we are out in the community quite a lot as well. So we do work in schools and we do work in GP and other primary care sectors. So I'm just going to tell you a little bit about who we are and what we do. So Tameside Oldham and Glossop Mind has been going for over 40 years. It was set up by local community members to provide mental health support to other local community members. And then they became affiliated to National Mind. We now work across Oldham. We've been in Oldham for over 15 years. And we typically see around 5,000 people a year in lots of different areas. So that might be people in around population health and doing some education around how to have positive mental health, as well as people who are experiencing themselves in a crisis. And that's a self-defined crisis rather than very criteria-led. So these are our values. Our values were developed with all our staff, volunteers and people who use our services. We see the people that we're working with as the experts of themselves. And our values and our aims is to create an environment where people can get what they need in order to be able to thrive. And again, that is what that means for that person. Okay. We've just implemented our 2022-2027 strategy. We went out and we did some work with members of our community, key stakeholders, people who use our services, staff, volunteers. And these are our strategies. We've got some objectives under it and the link is there. I don't know if the slides go out. If you click on it, you can see the full strategy. So the cost of living impact on mental health, and I think I'm not going to be saying anything that you don't already know this, but it's absolutely profound. The helplines are finding more and more people calling in relation to the cost of living. In Oldham, we are seeing many more people coming self-defined crisis because of the impact of the cost of living is having on theirs and their families' mental health. And you know, for the first time, young minds have started to track the worries that young people are having, and that is getting to be really concerning too. So our services, we are open from 8 AM till 8 PM Monday to Friday, and Saturday 10 AM till 2 PM. Anybody can walk in or call at any time, and we'll offer support there and then where we can. That might be that we're offering the support directly, or we're going to help them to navigate the services that are available in our in Oldham, rather than actually having someone just to keep phoning around and going on the merry-go-round of referrals. That will actually work with that person to help them do that. So we work with anyone from the age of 8 upwards. We offer family services. We have within our wellbeing centre, we do have a sensory room and facilities to support people. We offer face-to-face, online and phone support. It's non-clinical, so you don't have to buzz to get into a building. It's quite a relaxed setting. The area that we walk in, the children and the young people, is predominantly downstairs. They co-designed all the building with us, and we're working actually over 100 different partnerships across the Oldham. So we do deliver a lot of our service holistically in partnership with other services. So these are the specific services. So for adults, we're part of the Living Well model. And what that is working with other voluntary sector and public services. And it's typically for people who don't tend to meet criteria within the mental health system and end up falling through the net or the gap. So we work, our role in that is that we have navigators, and they will help the person to get a package of care around them. So it might be that someone is accessing a psychologist, as well as actually working with a peer support worker, as well as working with a navigator. And it's quite intensive work, and we work with people typically for about 12 weeks. We also offer counselling, and we do some counselling as part of the improving access to psychological therapies. So we work in partnership with Healthy Minds on that. And we also do something that's called active monitoring. So when you go to the GPs for around your mental health, according to the NICE guidelines, the GP would normally do something called active monitoring, where they might give you some self-help tools to do and then check in with you. We do that in a more proactive way. So we do it on behalf of the GPs. So the GPs will refer people to us, although people can self-refer. And we've got lots of different pathways of low mood, anxiety, isolation. And we're actually working on a menopause one with the active monitoring. And National Mind have got these as actual packages of care. We have listening spaces, and this is just for people just to turn up when they feel they need some support. I say anyone can turn up from AM to 8 PM, but these specific listening spaces, listening lounges, where we'll actually do some work with them. And we have the Safe Haven, so we run this in partnership with Pennine Care, and that's an overnight service. You can't self-refer to that at the moment. It has to go through the access through A&E. So what I'd be saying is, if you're working with anyone, tell them to come to our listening spaces. We do quite a lot of community development work. We work with lots of racialised communities. We also work with older people experiencing dementia. We do work with Age UK around that. Children and young people, we do coaching, counselling, art therapy, different wellbeing activities, peer support. We also do counselling in schools, family support, and again help work with children and adolescents mental health services CAMS, helping similar to what we said with the adults for the Living Well, doing some navigation there. And then we do lots of marketing and social media events as well. So that this is a little bit more about the Living Well service. So as I said, it's a package of care. So we're working in partnership in a multidisciplinary method with people to make sure that they are being supported. Very often, people that go to the Living Well service might not have a diagnosable mental health. It might just be more around the social care that's impacting on their mental health. Okay. So some of the talking therapies and the facilitated self-help, active monitoring I've advised around. Silver Cloud is an online self-help platform. If they come and do it by us, we'll assign a practitioner to work with them to help them support going through that. Counselling for depression, and we do have some open access counselling in Oldham as well. There are opening times in relation to the listening spaces, so I just wanted to include all these, so when the presentation comes out, that you've got access to seeing those spaces if you wanted to refer anyone on. The Safe Haven, so that's what it looks like at Oldham. And that is for people who are going to A&E but wouldn't necessarily be admitted into the wards but need some crisis support. We'll work with some clinical mental health workers at the hospital, and that's what the base looks like. We also do some work, steps to home, and this is people who are in hospital and they are ready to be discharged, but they haven't got the safe environment to go home to. So we'll work with them to make sure they've got the support, because very often in the past, when people have been discharged, it's almost like going off a cliff edge. You get very intensive support to almost nothing. So we'll work with them. Sometimes some older people will need care support putting in so they can go home, and it's so we can get people home as quickly as possible. That's our postcard that I've got on there for our children and young people. So if you wanted any of those, you can call in, we can give you some for you to hand out, or again, if you direct people to our website. So this is this is just some of the partners that we work with. So we co-facilitate a psychological medicine group that's it's moving on to peer support. We are part of the multi-agency safeguarding hub, and what happens there is when people, like say GMP, the police, of having lots of call outs to the same person, that person will be discussed as part of the MASH, and we will then decide collectively about what package of support we can put in. And very often there's people that will go there that won't meet this social care criteria, they won't meet the mental health secondary care criteria, they won't meet the IAP criteria, and that's where us as a sector will then go in and do some work with them. Turning Point is co-locates with us, so they're based in our building, and we've done some joint work where one of our workers and one of their workers has worked together with a person. We work with Age UK on a number of things, and Positive Steps, who also are really doing a lot of work with people around the cost of living, helping people looking at benefits and so on and things like that. I'm hoping I've covered everything, but absolutely feel free to ask me any questions at all.